Hi everyone, Kelly Laassadi here. I am a Gold Executive and also on the presenters board with Essante Organics. And I have a special guest with me tonight. We're talking about a pretty important topic. If you know anybody that has children with autism, Asperger's, ADHD, ADD, give them a text, give them a call, and see how you can get them on the line. Send them the link because we have some testimonials that we're going to share with you. I'm going to be going over one person's journey in some pretty great detail. And I hope that, it will help someone else out there who's dealing with the same issues. So get a pen and paper. You might want to take some notes. I first want to introduce to you, just to say hello real quick, we have Melissa Briggs on the line with us. Say hi, Melissa. Awesome. And we're going to be talking about ways to deal with these situations naturally. I'm going to be talking about my friend Ashley Anderson, whose son was diagnosed with autism and ADHD. And Melissa also has a son who is undiagnosed, but has a lot of the same symptoms. So what I'm going to be sharing a couple other testimonials with you as well. So to start out with, Melissa, would you like to kind of share a little bit about your story and your son's situation with everyone?
Yeah, sure. So my son, he is 10 years old, and ever since he was very, very little, he's had a lot of anxiety. He has a really short temper. Like Kelly said, he has a lot of symptoms that are similar to those with autism and ADHD. A few years ago, I took him to a therapist, and they said there's nothing wrong with him, but I always felt that he was different, and did ever since he was very little. He fights a lot with his brother, which that's normal, and they're only 13 months apart, but he would get really angry. It was just little triggers that would set him off, and he would just go flying through the house and flipping out, and it's been very sad to watch that. But we started using the stress-reducing mist about 2 months ago, and he is so much calmer. He actually doesn't argue with his brother as much. His outbursts aren't nearly as severe. He still gets upset, but it's not anything compared to like it was before. He calms down a lot quicker, and then he bounces back. And his homework. Before he didn't really want to do his homework. He gets this math homework pack, and he has Monday through Thursday to do it. And I'd struggle with him. My husband and I would fight with him every night to get him to do it. It's not something that he was interested in, so he didn't want to focus on it. But actually, the last few weeks, he's been sitting down. He's been doing his homework. He's been focusing. He'll come to me, and he's like, "Mom, look, I already did all of this." And we have seen tremendous changes, and we're so thrilled, to have our son be calmer and more level-headed. He doesn't stress and worry as much as he used to. So, it's like he's normalizing, and he's not as far out there, because he was so spaced out all the time because he carries all of this stress on him. It's not healthy behavior for children. So he's calm, and he's a lot happier, and it's very gratifying.
Thank you so much, Melissa, and we'll come back to you here in a couple minutes. But I love that you mentioned, that it helps him to focus, and that's something that he was having an issue with. Because my friend, her name is Ashley Anderson. She is a wealth of information on this subject. She was having some connection issues with her internet. So the nice thing is that I have kind of walked through this journey with her son. So I've been able to watch her very closely. And then she is very open to, you can feel free to anyone on this hangout to, here's her story, or would like more information or clarification. She, is a great resource, and I know that she, would be just fine with anybody contacting her that would need to. But that's one of the things that I was pretty excited about. I remember the first time that Ashley told me, we're sitting in dance class, and she's like, oh, I was talking to, her son's name is Grady. And she's like, I was talking to Grady's teacher, and, we were just so excited because, she was telling me how for the first time he is able to actually focus on the task that he's doing. And I'm gonna tell you guys kind of step by step what Ashley has been doing. And I'm gonna start with her testimony because I know it in the most detail. And I really admire her because, I remember also the day that she told me that her son's doctors wanted him to go on medication. They told her, and she did go through a lot of the things that you shared with me, Melissa, that you have been going through with your son as far as it can be difficult to get that diagnosis. And I know that it took her a lot of time. She saw a lot of doctors, and finally she and the thing that she says about that is, don't give up. Your child. So if there's something that, because early diagnosis is so important with these conditions. Children's brains are developing the most. They're learning the most in the first 5 years. So if you can figure out that there's something that they need some extra help and get that for them when they're very young, they have a great chance of being able to be in a normal school and to go on and, do all the things that you want them to be able to do. And that's what she's been able to do with her son. And I know it hasn't been an easy journey for her. So that's why, I really love her story, because she's, she didn't give up when they told her that there's no way. As a matter of fact, she shared with me that one of her son's teachers told her, I've been doing this for 15 years. I've never seen a child with Grady's situation not be on medications, so she had all these people around her son's doctors, her son's teachers, insisting that there was no other way but to put him on medication. And she, that first conversation that we had when they were initially wanting to put him on medication was a year ago, maybe a little over a year ago even, and he is doing fantastic right now. So that's why we're sharing the story with you and hoping that it can help somebody out there. But a couple of things that Ashley does, and then I'm going to be turning it back over to Melissa as well. But she first saw a holistic doctor with him, actually a chiropractic doctor, and I referred her to this chiropractic doctor at the time that we first talked about it. This was probably more like a year and a half ago, I would say, because it was before Essante Organics, before we knew about the products. And so she went to see this doctor, and he did a nutrition response testing with Grady, which I had done with my daughter for a different condition, and that's how I knew about it. And this chiropractic doctor said that he takes every child that comes through his doors off of wheat and dairy first thing, because almost every child has some sort of sensitivity to these things, whether you're noticing it, whether you're realizing the issues are coming from that or not. So Ashley did that, and I remember she was a huge couponer, okay? So for her to, just give up buying, because that's what they give you coupons for, right, is like all the bad stuff that, so she completely took him off processed foods. She took him off of sugar. Sugar is so bad for every child, but especially with these conditions. You really want to try to avoid it. It's not easy everywhere you go, like schools, churches, every place you go, pretty much they're shoving sugar in your child's face. So that's not an easy journey, I know from experience. But it is important to try to get those things out of their diet. And then also the dyes, red dyes specifically, she makes sure to avoid with him. After doing these things, she started to notice, some results. She started to notice some changes in his behavior, that were positive, and so that kind of gave her the encouragement to keep going. They use almond milk instead of regular dairy, for example, and so that did help. And then it was, several months after that, like I said, about a year ago, that that she had come to me about them wanting to put him on medications, and that's at that point, I had found and started using Essante Organics products. My daughter had an allergy, I believe, some type of allergy. We never really figured out what it was, but they had her on a medication she was having eye pain, and she had this, she had it almost every night, and she would cry with it. So I'm very anti-medication. I'm not one to be on medications or to have my children on medications. So I hated having her on that, but I also didn't want her to see her crying every night. So I had actually put her on it, and we had also went off wheat and dairy, and the processed foods we made sure to eliminate out of our diet completely. And we also saw some results with that, but it didn't alleviate the problem. We weren't able to take her off of the prescription that she was on. When we tried to do that, it would get worse again, like she would have it every night again. So what we did was, when I found Essante Organics, we started alkalizing. We started using the reds and the greens, and also the B tabs. And what we found out is after a month and a half, we were actually able to take her off that allergy medicine. And as long as she has those, she has no issues, thanks God. If we do run out of them for a week or so, then she does have to, it has to get back in her system again. So her eye pain actually comes back. So when Ashley and I were talking, I told her that we were able to find some things that were really working for us. And at this time, I don't believe I was even promoting the products. I was just using them for several months before I became an executive and started actually promoting Essante products. So she also tried them. And what happened was, we were sitting in, probably several months later when we were talking, and that's when she told me, his teachers are amazed. She said they asked me, what are you doing different? They actually called her and said, what are you doing different? Because Grady is able to focus. He's able to, stay on one task and pay attention, which he hadn't been able to do so well before. And so they were just really excited about that. And of course, Ashley is really excited about that. But so I'm just going to go over with you briefly what she has Grady taking. And I do want to say that, Essante products we do not claim to cure or prevent any diseases. The thing that is absolutely amazing is God designed our bodies to really be able to take care of itself, so to speak, if you give the body what it needs. So I always say Essante Organics just did a really beautiful job of providing us with products that use God-given ingredients in their whole natural form, without any of the chemicals, without any of the junk, and that's why they work so well. That's why they work so well for my daughter and for us, and also for Ashley and her son. So she uses, first of all, the omegas. They are good for brain function, the Essante Organics omegas. They're good for brain function and memory. They promote normal bone development. And the pretty exciting thing that Ashley just told me today is that Grady was on doing OT, occupational therapy, every week for most of the time since he's been diagnosed. And then he was able to be toned down to like every 2 weeks and every month. And she was just telling me today that he just had his occupational therapy visit, and he no longer has to have therapy at all now. And the reason is because, usually children with these disabilities, they have very weak muscle control. You know, they have weak muscle tone and don't have very good muscle control. So they've actually been able to build that up to the point where they're saying he no longer needs that occupational therapy. So we're super excited about that. And the other thing that she takes is she does do the mandarin green, which is an essential oil. And that is great for mental depression, mental distress. It's great for anxiety. And she puts that in the dryer with his clothes. You know, there's all kinds of ways you can use the essential oils. We have a fantastic diffuser that you can use to diffuse the oils in your house. A couple other oils that are really good for these situations is the lavender oil, which my friend Amanda Williford also has a child that has these conditions, and she uses the NAPCA mist, just like Melissa does. And then she also shared with me that she uses the lavender oils and the happiness oil. Happiness oil, it stabilizes mood swings, it decreases anxiety. It's great for stress, for depression and mood swings. So those are just some of the oils that can be helpful with these conditions. The other thing that she really uses, that Ashley uses really loyally, is the Essante Organics greens. And what I'm going to do, Melissa has just recently in the past week started using the greens with her son. So I'm going to pass it back over to her and let her just tell you a little bit about those. Back to you, Melissa.
Okay. So this greens actually have the container here. It's a very small container, but there's 100 servings in it. It is 100% organic. It's gluten-free. It's raw and vegan. It increases alkalinity and your immune system. It's good for your digestion. It's 5.5 pounds of organic greens in every serving. So it's really, really powerful stuff. And like Kelly said, I just started using it in the last week for my children. I pack their lunches every day, and I put it in their water bottles. And it's really not a flavor that kids are going to like, but I mask that by making lemonade with it. So in their water bottles, I do filtered water and lemon juice and stevia, and then a scoop of this. They each get a whole scoop and shake it up, and they drink it up. They love the flavor. When you put lemon in with it, it really masks the green flavor, and then the stevia sweetens it a little bit, and it's really delicious. That's actually how I drink it every day too.
Awesome. Thank you so much, Melissa. And I just wanted to talk to you guys a little bit about the B tabs that I mentioned. These are something that I take myself personally. I also give to my daughter. That's how we got her off of the medication. And then, you know, this is one of the things that my friend Ashley is very loyal to for her son. What she said is that the B tabs, and she's had times where she shared with me that she's had times where she's actually had, you know, like they ran out and had to wait for them with the B tabs, and so that helps with his emotions. That helps keep his emotions in check. And when he hasn't had those, they've really noticed a difference in that. So, and then the omegas, she said, really helps him with focusing. So they kind of seem to play two different, you know, roles there for them. And the B tabs have every known ingredient that is needed to sustain life. So a pretty potent they're little chewable tablets, and they're very easy to take. My girls actually take them like candy every day. You know, they ask for them if I forget to give them, so they really love them. If your kids like the taste of honey, they'll be very easy to give. I actually just break mine up, put it, you know, break it in half and put it in with my alkalizing shake that I take every day. And but they are antiviral, they're antifungal, antibiotic. They have bee pollen, royal jelly, propolis. They have like 22 amino acids, 27 minerals. They have the coenzymes. They have calcium and zinc. Another thing that I do want to, they're great for like stamina, immunity, hormone regulation, so also for digestion, which I know can be an issue too. And the other thing that I wanted to touch on that, two more things that are very important that sometimes people don't think of is number one is toxins. Chemicals and toxins are very, very important when it comes to these conditions because the immune system already tends to be compromised. So if you're adding all these chemicals from, the lotions and the shower gels and all the things that we use, most people when we get up in the morning and we take a shower to start our day, we put on more than 250 chemicals onto our body. And for a child whose body is already fighting these other issues, that is a big deal. So I know when Ashley shared with me that when her son was tested, he tested very high for chemicals and heavy metals. So that's one of the things that they did early on when we found Essante Organics is they, eliminated, she got all of the Essante Organics products, which are certified toxic-free. We have the toxic-free logo. So the Toxic-Free Foundation has actually certified that there are no chemicals in there. So that is pretty important. You don't have to just take somebody's natural, doesn't mean anything. So don't just take somebody's word for it. You want products that are chemical free when it comes to this situation. And so they eliminated all the chemicals that they could from his environment. Is one of the first things that they did. They switched over his soap to the Essante Organics shower gel, and they switched over his toothpaste to the Sparkle toothpaste. And there are hangouts that you can go on and trainings that you can go in and listen to on each one of these specific products to get more information. You can also go on to the website or the website of the person who sent you to this hangout and get some more information on each individual product. We also have testimonials and clinical trials and the ingredients and everything right on there for you. And then the other thing that I wanted to mention was vitamin D has actually shown, there's been some new research done recently showing that there may be a direct connection between vitamin D and autism. This is the research was specifically on vitamin D in pregnancy. So our body actually requires a very high amount of vitamin D. So you want to make sure that you are, if you know anybody who's pregnant, you might just mention it to them. Definitely it's important to be getting enough. And we have a vitamin D supplement that is very, very good. And I would say that, somebody, if it were me, I would make sure that, my girls take the Cal Mag D altogether, which is a lower dose, but the vitamin D by itself has actually a much higher dose. And then two, Ashley mentioned that when the doctors and the teachers and everyone was telling her all this time that all the children they had seen with these symptoms always had to be on medication. They made it sound to her like there was no other way. That she had no other choice but to put her child on medications. And so the thing that I would just want to encourage everyone to do, the thing that Ashley kind of asked me to share with all of you is to trust your instincts and to trust what you see in your child and just keep seeking information. Don't just take one person's word for it. Seek information and, do your research and, see where it leads you, because there are other ways. And, I also have another friend, her name is Samia, and she was also supposed to be on the hangout. Everybody kind of skipped out on us, didn't they, Melissa? But she is also, she has a son who is diagnosed with these conditions as well. And again, I'm so very proud of her, because when the doctors wanted to put her son on medications, she didn't listen to them. She went with her heart. She fought against what everybody else was telling her, and she completely changed her. I knew her before she had kids, so I know what our diets was like at that time, and I know it's not easy to change. I went through that. We went through that process in my family as well, but it makes a lifetime of difference, I think. And her son, it does well. He's learning. He's in a classroom like Grady with normal children, and he's able to to focus and learn, and his body is getting what it needs. So, and also therapy and things that learning. There's different things that you want to look into as far as brain development on the learning side of it. So. With that, I'm going to give it back to you for a minute, Melissa, if you have any final thoughts that you would like to share with anyone, any advice to maybe help other mothers out there in the same situation.
Okay, yeah, for sure. I definitely want to reiterate that these products are all certified toxic-free, and it's just really comforting because I know that I can give this to my son every day and even twice a day on some days, just depending on how his day is going, and I don't have to worry about any side effects. These are real, natural, healthy ingredients. It's safe to use, and I can rest at night knowing that he's improving in so many areas of his life, and he's not having to sacrifice other areas of his life. There's no, like I said, there's no side effects. So these products are wonderful. I really can't say enough good things about them. And I just also want to include, I did a testimonial video on this, and it's not anything about what we were talking about, but as a result, my son doesn't wet the bed nearly as much as he used to. He was a chronic bedwetter, and now in the last 2 weeks, he's wet maybe once or twice. So it is greatly improved that, and I think it's as a direct result of his anxiety lowering. But I really hope that if you have a child who yourself or someone that's experiencing these issues, give these products a try. They are wonderful, and they will change your life.
Thank you, Melissa. I love that. And also my friend Amanda Williford wanted me to share this testimony with you all lastly before we wind up here. She says, my daughter Lauren was born with hearing loss. She has 20% hearing without her hearing aid. At age 5, she was diagnosed with Asperger's. She throws mild tempers for no reason at all. She has no empathy toward others. She has no feelings really other than frustration, and she also gets very angry very fast. The very best thing I have found to help my daughter is the NAPCA mist. I go through a bottle a month practically. We also use a lot of happiness essential oil. I run it in her diffuser as well as applying it to her pressure points, and it really helps calm her down and allows her to have less tantrums. Anytime my Lauren starts feeling frustrated or overwhelmed, I just spray her face with the NAPCA, and she calms right down. It's amazing to see, and I send it to school with her. Her teacher sprays it in her face when she needs it. So that's Amanda's testimony, and thank you guys all for watching and for being here. Again, if there's anything that that we can help you with on this journey, feel free to message us, and we can maybe help point you in the right direction if you're trying to get help with any of this. You guys all have a great evening. Bye-bye.